Free primary care. €2 prescription co-pays. Hospital stays with zero bills. This is Italy's Servizio Sanitario Nazionale operating right now for expatriates who understand how to access it. Italy's healthcare system ranks among the world's best. The World Health Organization places it in the top 10 globally. Bloomberg ranks it higher than the United States and United Kingdom for efficiency and outcomes. Italians live longer than Americans despite spending far less per person. But access is not automatic when you establish residency. You must navigate a registration process that varies by region. You must understand what the system covers and what it does not. You must know when private insurance makes sense. This is the complete healthcare guide. Registration steps. Coverage details. Costs by region. Gaps you need to know. Private insurance decisions. Everything based on expatriate experiences. Welcome to the channel. Subscribe because we explain what actually happens. The Servizio Sanitario Nazionale is Italy's national health service funded through taxation. Every legal resident contributes through income taxes and receives comprehensive healthcare regardless of employment status, age, or pre-existing conditions. The SSN operates through regional health authorities called ASL. Each ASL manages healthcare for specific geographic areas, assigns primary care doctors, processes specialist referrals, manages hospital admissions, and handles prescription subsidies. Italy has 20 regions with significant healthcare autonomy. This creates meaningful quality differences. Emilia-Romagna consistently ranks best in Italy and among Europe's best. Lombardy and Veneto perform excellently with more private sector integration. Southern regions including Calabria and Sicily have longer wait times, though quality has improved substantially. Regional variation matters for relocation decisions. Choosing a town in Emilia-Romagna over Calabria could mean seeing a specialist in 2 weeks versus 3 months. The system provides 3 care tiers. Primary care through your assigned medico di base. Secondary care through specialists via GP referral. Tertiary care through hospitals for emergencies and surgery. You cannot call specialists directly. You see your GP first. Your GP evaluates and decides if specialist referral is appropriate. This gatekeeper model controls costs but requires a good GP relationship. Registration is not automatic. You must complete it yourself. Step 1. Establish legal residency. You need official residency before SSN registration. Complete residency registration at your comune and receive your certificato di residenza. This takes 2 to 8 weeks after submitting application. You cannot register using just rental contract. You need the official residency certificate. Many expatriates go to ASL immediately after moving before completing residency. The ASL turns them away. Step 2. Gather required documents. You need residency certificate, passport, and codice fiscale. Some regions require proof of income or self-sufficiency such as bank statements, pension proof, or employment documentation. Income requirements vary by region. Northern regions verify income strictly. Southern regions often accept residency alone. Your commercialista confirms specific requirements for your region. Step 3. Visit your local ASL office. Locate the ASL serving your address. You must register with the ASL responsible for your area. You cannot choose a different one. ASL offices have limited hours, typically weekday mornings. Many require appointments booked weeks in advance. Check the website or call to determine if appointment needed. Bring all documents in original form plus copies. Application takes 30 to 60 minutes. Staff ask about residency, income, and health status. They explain the fee structure if applicable. Step 4. Choose your medico di base. The ASL provides a list of primary care doctors accepting new patients. You choose one doctor from this list. Consider geographic proximity, language capabilities, and appointment availability. Some doctors have very full patient lists with limited slots. You cannot change doctors frequently. Switching requires formal ASL request with valid reasons. Choose carefully. Step 5. Receive your tessera sanitaria. Within 2 to 6 weeks, you receive your tessera sanitaria by mail. This health insurance card contains your details and unique healthcare number. Present this card at every medical interaction including GP visits, specialists, pharmacy, and hospitals. If your card does not arrive within 6 weeks, contact your ASL. Do not assume it will arrive eventually. During the waiting period, use printed receipt from ASL confirming registration. Your GP has your information in their system before your card arrives. Primary care GP visits are completely free with no co-payments. You can see your GP as often as medically necessary. The GP provides consultations, examinations, specialist referrals, prescriptions, and sick leave documentation. Appointment scheduling varies by doctor. Some use online booking. Others require phone calls. Many operate walk-in hours for urgent issues. Specialist care specialist visits are free when accessed through GP referral and SSN system. Your GP writes a referral. You book with SSN contracted specialists. Wait times vary dramatically. Cardiology in Emilia-Romagna might be 2 weeks. The same in Calabria might be 3 months. Non-urgent dermatology could be 6 months anywhere. You can bypass waits by paying privately. Private specialist consultations cost €80 to €200. Many Italians use SSN for routine care and private payment for faster access. Hospital care. Emergency care is completely free. Emergency rooms use triage prioritizing by severity. Minor issues wait several hours while serious emergencies receive immediate attention. Planned hospital admissions for surgery are free when arranged through SSN. This includes pre-operative consultations, surgery, hospital stay, medications during hospitalization, and post-operative follow-up. You pay nothing at discharge. Hospital quality varies by region. Major hospitals in regional capitals provide excellent care. Smaller rural hospitals have more limited capabilities. Prescription medications have subsidized costs. You pay a co-payment called the ticket that varies by medication type and income. Essential medications for chronic conditions cost €2 to €6 per prescription regardless of market price. Insulin might cost €2. Blood pressure medication costs €3. Less essential medications have higher co-payments ranging from €10 to €30. Income-based exemptions exist. People over 65 with low income, those with chronic diseases, and those in severe hardship qualify for reduced or zero co-payments. Diagnostic testing. Blood tests, X-rays, ultrasounds, CT scans, and MRI scans are covered when ordered by your GP or specialist. You pay a co-payment, typically €0 to €36. Blood work might be free. A CT scan could cost €25 to €36. These are substantially lower than private pricing where the same CT scan costs €150 to €300. Wait times for diagnostics can be lengthy. An MRI might be scheduled 3 months out. Urgent needs receive faster processing. Dental care. The SSN provides minimal dental coverage. Emergency dental care receives treatment. Routine dental work including cleanings, fillings, crowns, and orthodontics is not covered. You pay out of pocket. A cleaning costs €60 to €100. A filling costs €80 to €150. A crown costs €400 to €800. Root canal costs €200 to €500. Budget €500 to €1,000 annually for routine dental maintenance. Vision care. Routine eye exams are not covered. Eyeglasses and contact lenses are not subsidized. You pay privately for all vision care. An eye exam costs €50 to €100. Eyeglasses cost €100 to €300. Contact lenses cost €30 to €60 per monthly supply. Exception: vision care related to diagnosed medical conditions like diabetic retinopathy receives some SSN coverage. Routine vision correction does not. Elective procedures, cosmetic surgery, non-medically necessary procedures, and experimental treatments are not covered. Fertility treatments receive limited coverage with strict criteria. Ambulance services. Emergency ambulance transport is covered. Non-emergency medical transport is not. Prescription medications not on formulary. The SSN maintains an approved medication list. Newer medications not yet added require full private payment. Some cancer drugs and rare disease treatments fall into this category. Emilia-Romagna, Italy's best healthcare system. Quality excellent. Wait times short. SSN registration free for EU citizens. Non-EU citizens with elective residence permits pay approximately €75 to €100 monthly based on age. Tuscany and Umbria. Good healthcare with variation between urban and rural. Florence, Siena, and Perugia have excellent facilities. Fees for non-EU residents range from €50 to €100 monthly. EU citizens register free. Wait times, 2 to 4 weeks for most specialists. 1 to 2 months for diagnostics. Lombardy and Veneto. Excellent quality particularly in Milan, Verona, and Venice. Extensive private sector alongside SSN. SSN fees for non-EU residents, €75 to €100 monthly. Lazio, Rome, excellent hospitals in Rome itself. Bureaucratic complexity typical of capitals. Fees for non-EU residents, €60 to €90 monthly. Southern regions. Urban centers like Naples, Bari, Palermo, and Catania have very good hospitals. Wait times longer on average. Specialist appointment taking 2 weeks in Emilia-Romagna might take 6 to 8 weeks here. Significantly lower fees. Many southern regions charge minimal fees, sometimes €0 to €30 monthly. Calabria has very low healthcare costs. For healthy expatriates needing preventive care, southern Italy offers excellent value. For chronic conditions requiring frequent specialists, northern efficiency may justify higher costs. Dental and vision coverage. Private insurance includes dental benefits covering cleanings and fillings. Vision coverage includes discounted exams and glasses subsidies. These policies cost €40 to €80 monthly. For people maintaining regular dental care, insurance can pay for itself. Faster specialist access. Private insurance allows immediate specialist access rather than waiting weeks or months. International coverage. Some policies include coverage outside Italy for emergencies. The SSN provides very limited coverage abroad, only in EU countries for emergencies. Total private insurance costs. Comprehensive private insurance costs €100 to €200 monthly depending on age and coverage. For someone over 60, expect €150 to €250 monthly. Many expatriates start with SSN-only coverage for the first year to understand the system. After experiencing actual wait times, they make informed decisions about adding private insurance. The mistake is buying expensive private insurance immediately based on fear rather than evaluating actual needs. Many discover the SSN meets most healthcare needs adequately. Build relationship with your GP. Your medico database controls system access. Invest time building rapport. A good GP relationship makes everything easier. If your initially assigned GP proves difficult, begin the process to switch doctors early. Learn basic medical. Italian healthcare interactions happen in Italian except in major tourist areas. You need vocabulary for symptoms and body parts. Bring a translation app to appointments if necessary. Bring documentation from home country. Medical records, vaccination history, and chronic condition documentation help Italian doctors provide appropriate care. Translate key documents into Italian if possible. Have English language records available digitally. Understand appointment scheduling norms. Italian healthcare does not operate on American efficiency expectations. Appointments might run 30 minutes behind without apology. Accepting these norms reduces frustration. Leverage private care strategically. You can pay out of pocket for specific private specialist consultations when SSN wait times are unacceptable while using SSN for everything else. A private specialist visit costs €100 to €150. For urgent non-emergency situations where waiting 2 months creates anxiety, paying for immediate private consultation makes sense. Verify coverage before procedures. Before agreeing to expensive diagnostic tests, verify SSN coverage with your doctor. Ask explicitly, is this covered by SSN or will I pay privately? Children registered with residency automatically qualify for SSN coverage with no separate fees. Pediatric care through SSN is excellent. Vaccination programs are comprehensive and free. Italy requires specific vaccinations for school enrollment. The ASL provides these at no cost. Pediatric emergency care is very responsive. Children receive priority. Most regions have specialized pediatric emergency departments. Orthodontics and dental care for children have the same gaps as adult care. These costs can be substantial for families with multiple children needing braces. Italy ranks 4th globally in WHO healthcare performance. The United States ranks 37th. The United Kingdom ranks 18th. Life expectancy in Italy is 83 years compared to 78 in the US and 81 in the UK. Infant mortality and maternal mortality rates are lower in Italy than in the US. Healthcare spending per capita is approximately €2,500 annually in Italy compared to €9,000 in the US. Italy achieves better outcomes while spending far less. Can I use SSN immediately after registration? Yes. Coverage begins the day you complete registration, even before receiving your card. Your GP and hospitals verify registration electronically. What happens if I need emergency care before completing registration? Emergency rooms treat everyone. You will be billed after. Present residency documents and explain you are registering. Hospitals can sometimes retroactively apply SSN coverage. Do I lose SSN coverage if I travel outside Italy? SSN coverage continues while you maintain residency. However, coverage outside Italy is limited to emergencies in EU countries. Can I choose any doctor as my medico database? You must choose from the list provided by your ASL of doctors accepting new patients in your area. What if I need care not available in my region? Italy allows inter-regional care. You can receive treatment in different regions if referred and if specialized capabilities exist there. Italy's healthcare system is genuinely excellent. Quality of care is very high. Costs through SSN are remarkably low. Life expectancy and health outcomes prove the system works. The challenges are bureaucratic rather than medical. Registration requires initiative and navigation. Regional variations affect experience. Language barriers create difficulties if you do not speak Italian, but these administrative challenges are entirely manageable with proper preparation. Tens of thousands of foreign residents successfully access Italian healthcare annually. Healthcare should not prevent you from moving to Italy. Understanding the registration process, coverage details, regional costs, and strategic use of private insurance allows you to access one of the world's best healthcare systems successfully. Like this video if comprehensive healthcare information helps you plan. Subscribe for detailed practical guidance. Tell us in comments what healthcare questions you have or share your experiences navigating the SSN system. Access to excellent affordable healthcare is one of the genuine advantages of Italian life. Now you know exactly how to access it.